Thank you, Sarah. Good morning and welcome RHD. There are over 100 people, so I'm going to say let's get started. Our agenda today is Marco is going to do some opening remarks. We'll put up that slide one more time so people all know all the ways they can submit their questions. Brian will take us through a numbers update. We haven't gotten to hear from Brian for a couple weeks, so we thought we would do that, and then we will jump in to your questions. Marco.
Good afternoon and almost noon, everyone. Can everybody hear me all right? All right, great. As Sherry shared, I'm Marco Giordano, your CEO. I thank you all for joining us again today. I do want to start us off today with an update on Hurricane Ida and the impact that the hurricane has had on our RHD community in Louisiana. We have been in contact with Sean Randall and Jan Tarantino, as many of you probably know, as our service line director and regional director for Louisiana. And as many of you have seen, New Orleans and the surrounding parishes were significantly impacted by the hurricane. The power's out and may be out for a long period of time. Our team has begun to connect with staff and the people we support as best as we can at this time. Please keep everyone in Louisiana in your thoughts and prayers as they assess the damage, reconnect with the community, and recover. As we learn more and understand what may be needed, we will definitely share it with the larger community, the larger RHD community. The resiliency of our team in Louisiana has often been tested, and with the support of the larger organization, all of us, we will get through this together. So again, keep Louisiana and our folks down there in your thoughts and prayers today. So today's session has been designed as a Q&A session, an opportunity for staff to ask questions as we continue to navigate the pandemic together. But before we hear from Brian and open the floor to questions, I would like to share an update on RHD's response, specifically regarding vaccines. As some of you may be aware, on August 16th, the city of Philadelphia issued an emergency regulation mandating vaccines for healthcare workers. This regulation requires healthcare workers to be fully vaccinated by October 15th. Fully vaccinated meaning it has been 2 weeks since the final dose of your vaccine, final dose of vaccine. All RHD staff that work at a Philadelphia location where individuals receive services, regardless whether the employee provides services, must be fully vaccinated. While we may identify certain RHD sites or spaces as exceptions to this mandate, there will be very few, if any. The mandate only allows individual exemptions for medical and religious purposes. An individual may not simply opt out and may not opt out due to philosophical or moral exemptions. Routine and frequent testing, while still critical in diagnosing the virus, is no longer an alternative option to being vaccinated in Philadelphia if you're a healthcare worker. I shared our meeting last, 2 weeks ago on the 16th. Our health centers moved forward with requiring the vaccine for all staff, and at that time, we were evaluating our approach for the rest of the organization. The City of Philadelphia mandate is now beginning to inform our path. In addition to the city, several other states have begun to communicate vaccine mandates. Each of these mandates will inform what we must do and will guide what we do across the organization. Our focus will need to be on operationalizing the mandates in Philadelphia and in other states. The COVID vaccine committee is developing tools and processes to assist us and to allow us to ensure our compliance along the way. It is our intent to roll out vaccine requirements to all programs at all locations that RHD operates across the country over a period of time that has not yet been determined. While we develop process and create protocols, if you are unvaccinated and employed in the city of Philadelphia, we ask that you seek out what information is needed to assist you in making your decision now. as well as to support those that are on this path. As stated earlier, the City of Philadelphia mandate requires all healthcare workers to be fully vaccinated by October 15th, which is approximately 6 weeks away, allowing minimal time as a 2-dose vaccine will require a 3 to 4 week waiting period for the second dose and 2 weeks subsequent to be fully vaccinated. Our actions and protocols continue to focus on our goal to provide a safe and healthy environment for the people we support, our staff and our families. We have learned over time, while we support many of the most vulnerable individuals in our communities, COVID-19 does not discriminate. It is our responsibility to do all that we can to provide a safe and healthy environment in a way that is consistent with our value of respect for the dignity and worth of every individual as well. We won't have all the answers today, but welcome any questions regarding the City of Philadelphia mandate, as well as the path we are on as part of our Q&A session. So again, thank you all for joining us today, and I'll turn the mic back over to Sherry.
Thank you, Marco. Sarah, would you mind putting up the agenda one more time, mostly so that we can show the various ways in which you can submit your questions? Oh, first page, yeah. So again, I'll encourage folks, feel free to start putting your questions in the chat. There is the Your Voice. Sarah will be monitoring your voice. That is confidential. She checks it, I think, every probably minute or two. So I feel confident that she's keeping up on that. The COVID-19 inbox, I don't actually know if we've gotten many questions through that, but that absolutely is another option. And then we'll also monitor the raised hand, and we can unmute you and you can speak directly if you'd like to submit your question that way. So I'm going to turn it to Brian for the update on the numbers, and then we'll open it up for Q&A. Thank you. Brian, take it away. After Sarah takes off, I'm sure she's trying to take off the slide. There we go. Thanks, Sarah. All right, we're going to pass it over to you, Brian. Brian, we can't hear you, but I think I see.
Can you hear me now?
Yes.
Oh, okay. There we go. All right. Take 3, third time's a charm. So currently we have received a total of 2,888 reports since we started receiving reports back in March of 2020. Of those reports, we have seen 817 confirmed cases, 1,503 negative cases, 79 suspected, and 477 possible exposures. So what I'm going to do is I'm going to share my screen at this time to show the graph that we've been keeping. And it's going to show us a few things. Can everybody see the screen? Okay, thank you. So what you're looking at here is we've had a pretty active August so far, and we started to see the current uptick that started back right around the July 4th holiday, right after the July 4th holiday. And since the last time we met on August 2nd, we've actually received 82 new reports, and 19 of them were confirmed cases so far. And of course, what we do is we do go back and we try to update those cases as we move forward as well to get an accurate count of how many actual confirmed cases that we've seen. So with that, I just want to talk a little bit about what's happening from a national perspective as well. I'm sure everybody has heard about the Delta variant and how that's really been pushing up the numbers nationally. So for that, specifically in the nation, we've seen the South is really kind of being hard hit, Florida, and also some other places that cropped up too. Oregon and Hawaii have actually kind of gotten onto the radar too with their uptick in cases as well. So, really what that tells us is we need to really remain vigilant and make sure that we're doing the things to protect ourselves and our families and our clients. And like we've been saying before, just really, like wearing a mask, watching your distance, washing your hands, doing those things that really have helped us in the past when we saw reductions of numbers, either here at RHD or nationally. So that is my update, and that is all I have for this week. So I'm going to toss this back to Sherry to take it from here.
All right, thank you, Brian. We always appreciate hearing from you. And so I see we already have some questions in the chat, and it is about Marco's opening comments. So Marco, I'm hoping you've had a chance to look at that and can take a moment to clarify.
Yeah, so the question in the chat was whether or not every employee is required to get a vaccination, if I recall. I didn't go back into it. And I think the response to it was pretty accurate, but I'll provide some details. So again, what I shared in my opening is the city of Philadelphia has issued a mandate that any individual that is working in a healthcare setting will need to be vaccinated by October 15th. So that's about 6 weeks away. So RHD's services and the settings that RHD operates are considered to be healthcare settings. So the mandate is applicable to us. So we are, we'll be looking for any individual that is providing services or that is working within those settings, even if not providing direct care, that every individual is vaccinated. If I were to say that differently, in order to provide services, in order to do the work that we need our staff to do, they will need to be vaccinated in order to do so. The city is allowing for exemptions, but only exemptions that relate to medical and religious needs, which there will be a process that we will follow in order to review and approve those exceptions, and that is an internal process. The COVID vaccine committee is developing those processes and protocols, those tools that we need. But in the meantime, what would be important is that if anyone that is unvaccinated, that those individuals are gaining the insight and information needed in order to make a decision. It is still a decision that each individual needs to be made. That needs to be made by each individual and or to support those folks in that decision-making process.
Great, thank you, Marco. So there is another one here about the vaccine, so I'm going to put that one out there. And I think, Sarah, you have some also about the vaccine as well. This one is, what should we do if we have parents of individuals that opt out of having their children vaccinated? And I'm not sure who's taking it, if that's risk or.
Sherry, can I just ask point of clarity? This is Alicia. I think it's saying parents of individuals that we support. So parents of our consumers who opt out of having our consumers vaccinated. So I think, again, just so you're clear, so that people can know who would need to answer. I think Brandon or Linda, because it's a consumer related one.
Yeah, thanks, Alicia. I appreciate that. Yeah, this is a toughie, right? People have differences of opinions about the vaccines, and it is a choice for our consumers to be able to make with their guardians and their loved ones. So if a parent is advocating for their child, their loved one not to get the vaccine, we obviously want to educate. We obviously want to encourage. But at this point, unless there is a state or under mandate for our consumer to get the vaccine, we are not mandating this for consumers. What that would mean is that if you're working in a home that has a consumer who has a parent or themselves, they choose not to be vaccinated for whatever reason that is, we would want to make sure we're taking all the precautions, using our PPE, appropriate attire, appropriate cleaning precautions, to make sure that we are doing our very best to keep them safe, but also to keep ourselves and others around us safe in that environment. I would encourage you, I mean, I'm certain your supervisor will be aware of that and probably will have shared that with you or the team, and that's how you might know it. But if for some reason the team is not aware of a decision like that and you've heard it, please make your supervisor aware, your team lead aware, so that they can have that conversation with the team. And hopefully through some better education and supports, we can show the parents and the consumer that it's safe, that there's nothing to worry about, and that hopefully it's the right decision for them in the future.
Thank you, Brandon. Sorry, a little trouble unmuting there. So we're getting lots of questions in the chat about the vaccine, but before we go there, let me just turn it over to Sarah, who also had vaccine questions, and then we'll go back to the chat.
Thanks, Sherry. Okay, let's see. Does the Philly mandate apply to workers who work in Philadelphia and or also those who live in the city but work in other counties? Yeah, so maybe some clarity around like it's just folks who work in Philly or live in Philly but work in other counties. If there's any information we have on that.
My understanding, and I'll look to others to confirm, is that it is whether you are working in the city of Philadelphia. So if you are residing in Philadelphia, working outside of Philadelphia, it does not apply. But if it's for those folks that are working within Philadelphia.
Which means if you live outside of Philadelphia but work in our programs in Philly, it does apply to you.
I have another question about the vaccine mandate. Are we requesting proof of vaccination from employees? And is there a plan to address the staffing crisis and how this may impact the crisis?
We do have a team that's meeting right now to determine what the requirements and the appropriate tracking will be. Obviously, we want to make sure we're following HIPAA requirements, medical information requirements as we do this. So we are consulting both risk, legal, operations, and DSIC team also is involved in the roundtable to make sure we're doing this in a way that not only is appropriate from a legal and from a operational standpoint, but also from a trauma-informed standpoint to ensure, because we know this is difficult, okay? Let's just say we understand that this is going to be a difficult process and difficult decision for many folks. So hear us that we did, it's not one taken lightly, and it is a mandate of our, of the city ordinance, or the county ordinance for Philly. So we will be looking to that for guidance.
Sherry, do you want me to keep going? Okay. How will this vaccine affect the use of temporary staff within RHD programs, namely PAIDD, since temp agencies do not require the vaccine for their employees?
The same requirements would apply to any staff that's working in Philly. So temp staff would be under no different regulation. So we would continue to enforce the vaccine mandate for any and all temporary staff that do work in our programs.
Sherry, do you want to go ahead and address some of the vaccination questions in the chat? Because that's all I have right now for vaccine related questions. The rest are about testing and working in admin spaces.
So we'll go back to the vaccination questions, but real quick, Brian, I see you confirmed 817 confirmed cases for RHD. And I think the question was, is the 817 for employees?
That is for a combination of employee and client.
Okay, great. All right, thank you. All right, so let's see. So I think we sort of answered that we're still figuring this out. Will we need to submit proof of vaccination for the Philly people? And if so, what is the process?
So Sherry, can I just add a thought there, and obviously others can chime in, and recognize that this guidance from the city is hot off the printers, right? So this is all relatively new, and there is still some work being done to interpret what is required. But as I said, we'll try to share as much as we can today with the community. But the city is requiring us to capture the documentation for that supports proof of vaccination. So that will be a component of our process. What Brandon spoke to was us figuring out the how. And so that is something that is being developed. But being able to share that you have a proof that you have received the vaccine will be a component of our process.
Marco, can I just add one thing? This is Stephanie.
Please.
Hello?
Yes, go.
Okay. I just wanted to add, as it relates to the Philadelphia mandate, everyone, right now, even Philadelphia itself is not specifically clear on what it wants to require and who it wants to include. As you heard Marco share, we are proceeding under the assumption that when they come out with any additional clarification, we could well be included in the definition of either a healthcare setting or healthcare worker. It will potentially touch everyone. I just wanted to make it clear is that if we are kind of included in, from what we know so far, they have broadly included that definition. So you could be an administrative person working not directly with any consumer and still come under that definition. In addition, we do not think that we know that Philly will not be the last area to create this mandate. So I share with everyone, if you were kind of on the fence, if you needed additional information, if you wanted to talk to someone, you have resources. I invite you to use any resource you please, but not to forget that you have resources within the company as well. You don't have to be in or from Philadelphia to ask questions of the health center. Always the RHD line that we have in risk at safety, RHD safety, is available to you so that you can get these questions answered. It would not be surprising if in very short order we see other areas where RHD works putting out similar mandates. So I just wanted to share that. And also, Marco wanted to agree wholeheartedly that we are really at the very beginning of this. And it's not just that we don't have all of the answers. Philadelphia, and we've had some folks go in and use their contacts to try and give us more information. And they have not yet quite settled in on the policy, which does require vaccination by October the 15th.
Just so folks know, I'm sorry, Stephanie, just so folks know, we've also got mandates from places outside of Philadelphia. Philadelphia is just the most recent one. The state of Delaware has a mandate, and they are mandating either vaccine or frequent testing on both the IDD side and the behavioral health side. The state of New Jersey has passed a mandate that as of yet does not include our folks. They're focused more on larger care facilities. So like Marco said in his opening, one, this is not just Philly. Philly's just the most recent one. And two, every edict or mandate is coming out a little bit differently. And that's why we don't have set answers for you right now. We're trying to take in all the information and get whatever clarification as we can, so our responses can be as inclusive as possible.
I think it's also important to share as in the context of this with what Bernie just shared, that there's also a path that we as an organization know we need to be on. We are supporting vulnerable individuals. Our goal continues to provide an environment that focuses on the health and safety of our staff, the folks we support, and obviously our families. To do so, we believe the vaccine is a a mechanism for us to do that. So while we are working through the mandates, we're also, as a larger organization, determining what can we do, what do we need to do, and what do we need to do and what can we do in order to achieve the goal, just the stated goal. In the environment that we know we're working in, where staffing is also very challenging. So I know that has surfaced in a couple of questions previously. It would be important to acknowledge that we acknowledge the impact on staffing that this could have. The thought is where we are working in an environment where it's being mandated, and not only mandated not just for us, but for all healthcare environments, those environments as well as the environments that some of the folks that that work with us will work elsewhere, that in order to be employed in this line of work in the city of Philadelphia and maybe across in other states, vaccination will be required. So therefore, the thought is while we'll have some impact, it might not have as much of an impact as we're all fearing.
Thanks, Marco. So I'm looking at the questions, and I think a number of them are going to be similar, in which we're still in the process of figuring them out. So what I'm wondering, Christy asked a question, will there be a communication? I'm wondering, I mean, we can ask them, but I recognize that many of them were still in the middle of talking through. If we could commit perhaps to a communication out, certainly one that even broader than this, right, to reach the larger RHD audience. We do save the chat. When we save the chat, all these questions are in there so they don't get lost. We keep them anonymous. So maybe that's a question to put out there so people can feel confident these questions are being addressed and the information will get back to them.
Yes, absolutely. Appreciate the question and the comment. That is the intention of our team that's been put together. There will be individual communications for the states that, or specific ordinances or locations that have specific mandates. But then we will also be doing a general information share out to the entire organization regarding the status of where we are with those decisions. Again, the likelihood that other funders, other areas will start mandating, we believe is likely, and we will have that help us determine some of our steps, but know that either way, we want to make the right decisions to keep our consumers and the rest of us around us working, our team members safe. And we believe this is the approach that will do that.
Great, thank you. So I see, I'll read them out, but I think a bunch of them we've touched upon or in the middle of working on. So are there any RHD incentives being offered to Philadelphia staff? Should a number of staff opt out, right? Will that exacerbate our staffing, which you just mentioned? Can we get clarification on who will require outside of Philadelphia? That needs, further clarification. Here's one that's slightly different. If a person already had COVID, why are they still required to get vaccinated?
Yep, Sherry, I'm going to hop in on this one. So Emily from the health centers. So previous COVID infection and vaccines produce different responses to protect yourself against COVID-19. So if you've had a previous infection, your body will produce a certain type of response. If you've had the vaccination, it's a different kind of response. So think about how doubly protected you may be if you've had a previous COVID infection and you also got vaccinated. The other issue is people are not sure how long our immune response lasts, both with COVID infection and with immunizations. So that is why, both of those reasons is why it is highly, highly recommended to get vaccinated at least 30 to 60 days post COVID infection to get vaccinated.
Great, thank you, Emily. Appreciate the clarification. Let's see. How soon can we submit the exemptions? Again, I'm going to assume that's one that's going to get more clarification. Thank you, Chris.
Sorry, not to be a stickler with language, I just want us to kind of have it in our head in the way that it will really occur. So Philadelphia they have not given exceptions. What will happen, what could happen is if once an organization is mandated, and so let's just talk about RHG, we're needing those in Philadelphia to be vaccinated by October 15th. If you have genuinely held religious beliefs or verifiable medical reasons why you cannot or it's contraindicated that you be vaccinated, you will submit that at the time. So if you already know and you're in Philadelphia and you know you have these issues, you will, I'm not wanting to say submit it, but essentially what will happen is the interactive process. If anyone's familiar with the interactive process under ADA, Americans with Disabilities Act, it is the same or at least a similar process. That process doesn't say you don't have to get vaccinated. It will say, do you have a request that is reasonably accommodated? So if you can be accommodated after your request is verified and you meet the requirements, then that accommodation will be made. So it has to be a reasonable accommodation, and that comes after you've demonstrated a medical reason or a religious exemption. So it's not, I submit this and then I'm exempted. It is a matter of a process that will then take place to see if your request can be accommodated under the law.
Thank you, Stephanie.
No problem.
And I'm going to take one more here and then pass it back to Sarah. So maybe the studies are surfacing that vaccinated individuals are still able to contact and spread the virus. What is the difference? So Emily, I don't know if this is another one that makes sense for you to take. I know there's a response in there, but I always like to say it out loud because we do have people who are on the phone and aren't able to read the chat.
Mhm. So just a quick question, Shannon, are you asking what is the difference between those who have previous COVID infection versus those who are vaccinated still contracting the virus? I just needed some clarification to that question.
So Shannon, if you can type your clarification in the chat, that would be great. And I'm going to say, Emily, let's take our best assumption on what she means there. Oh, right.
Nope, that's not it. But
No.
sure. I mean, so yes, vaccinated or not vaccinated, we can still contract the virus. The difference though is the severity of disease in terms of being unvaccinated versus vaccinated. So much is out there now about those who are vaccinated. The severity of a breakthrough infection is much lower than if you are unvaccinated. All of the, pretty much 98% of the hospitalizations across the country right now are in unvaccinated individuals.
Great, thank you, Emily. And Sarah, let me break it. Let me move it back to you for a minute for some other questions.
Sure. I have a question here asking if we should be advocating for the vaccine to our clients.
I could
I'll
jump
jump
in
in
really
on
quick. Oh,
Good. I was
So-
going to say that, oh, go ahead. I'm sorry, Sheena.
no, Bernie, you go ahead.
I was going to say that we should educate. We should make sure folks understand options. We should refer folks to their primary care physicians. Advocate might be coming close to overstepping our bounds. So educate, talk about options, and refer to primary care physician and let their doc advocate.
And I'm just gonna hop in really quick because what Bernie said is absolutely correct. And then if anyone, employees or clients, families have any questions, need more information, which is okay to ask questions. It's okay to be unsure. It's okay to want to know more. Please reach out to the RHD Vaccine Committee. You can email me directly. We are coordinating with FPCN, who have been so helpful in coming to the town halls to provide information about the vaccine from the beginning. About COVID from the beginning, the vaccines, the variants, and we'll continue to do that. So if anyone has information, whether it's an employee, a client, a family member, you can reach out to the RHD Vaccine Committee.
I have a couple of questions that kind of shift gears a little bit about sort of working in administrative spaces. I actually got two questions that are a little bit contradictory, but I'm going to read them both because they were asked. The first person says, I feel like with cases on the rise, RHD offices, I'm assuming administrative, should remain closed. If we can do our jobs at home like we have for over a year and a half, then we should. I don't think it's fair that certain positions remain at home while other positions in the office have to come in so many days a week and potentially be exposed. Not a specific question in there, but I do think that person is looking for some thoughts and information from leadership. And then on the other side of the spectrum, we also got a question asking when we'll be able to come back into the building. I'm assuming they mean corporate office, but they could be referring to any space. Can we come in a few days a week? So maybe we can talk a little bit about administrative spaces and sort of where we're landing.
Hey, Sarah, I just wanted to get on that before, because I know that it's going to take off, and I know there are several other people waiting to chomp at the bits, but I just wanted to highlight, I think that therein lies a little bit of our dilemma. I think that oftentimes what happens is you get, RHD is a very large organization with numerous people from varying perspectives that bring varying, we've always talked about multiple perspectives. And so I think some think that everyone wants one thing and others think everyone wants another. And your questions that you got demonstrate the exact challenge that we have. But that's not the real issue in terms of why some are coming into the office and some are not. The reality is the nature of your work for your department will really, truly, or your team or your office or your program really will influence what types of things can be done remotely and what types of things need to be done in the office. So as an example, there are still government that many of our teams work with or other organizations or companies that still use paper processes and are still mailing things that come to offices that have very sensitive timelines that need to be responded to. There are some functions that need to be done from the office, and there are some functions that can be done remotely. So I think, having the ability to be nimble to meet the needs of the corporation based upon the work that you do from your place in the corporation, from where you sit within the corporation, I think is going to continue to be one of the driving factors for that. So I just kind of wanted to put that out there. I thought what you are demonstrating is a classic conundrum that we have, that people might think that because they hold one perspective that it represents all employees in the corporation, and yet perfect opportunity to hear that you've got two completely different perspectives about what an employee might need or desire in terms of being able to be productive and effective in their work. And so what I said to my teams is, if you have, if you have the ability and you have the need to come into the office and maintain your level of productivity, then by all means, let us know that. We don't want to see people's productivity slipping because they can't get access to the supports that they need. So it really is going to have to continue to probably be up to manager. But I think I saw Stephanie come off mute, ready to jump in, and probably, I don't know, others are waiting to jump in.
Thanks, Alicia. Yeah, if anyone else wants to jump in with some, information on that, that would be helpful.
I would only say, I think Alicia said it very well. I would only offer maybe in addition to that, as she alluded to, we continue to gather information, watch for information, watch for funder updates, watch for CDC updates, and in various areas. So as the numbers continue to change, we will continue to review and update our protocols as necessary. We appreciate your flexibility. We know it's hard, but we are watching that almost daily now as things continue to change.
All right, so we do have a lot more questions about vaccinations and related things. So sorry, I'm just backing up here trying to make sure I don't miss too many. 1 second. We had a series that so there was the question, one, Emily, that you answered recently. I think this was to piggy off of that question. Studies suggest a person vax or unvax has the same amount of COVID in their system. Is that one you can take as well, Emily?
Sure, yes, because there's conflicting info coming out now. So I don't have a firm answer on this. There are some studies that say, yes, that fully vaccinated people are transmitting the virus at the same rate. But then now I'm recently seeing that the amount of virus in vaccinated people can also be lower. So it's kind of up in the air right now. There is nothing firm that is stating either direction of vaccinated or not vaccinated, an amount of virus that people have.
All right, thank you. I have to remind myself, so I'm just going to say this out loud, right? It's a new virus. So even some of these questions, we get conflicting information or information that changes as we learn more. So hang in there. We are doing the best we can to get you the latest. So I think a lot of the vaccine questions that continue to come still need further clarification. We recognize that it's a 10:15 for Philadelphia. The COVID committee is meeting tomorrow. So my hope is that we'll have at least a firm date when we can have the details ironed out for everyone. Is there anything we need to add about the vaccine and the unanswered questions?
There was just another good question that came up in the chat, Sherry, about if a person had COVID and you're not eligible yet by 10:15 to get the vaccination, what you should do.
Thank you, Sheena.
Well, I'll just jump in here. I think ultimately what Stephanie is saying is you should sit tight. I know that we are sharing this information. You're hearing it very early on. You heard Stephanie say the city is also being worked out. Today is August 30th. We'll continue to bring you updated information as soon as it is available and as it continues to unfold. But I guess what I'm hoping is that we won't go into a panic right now, right? That you're getting information very early. We are, as Emily just said, continuing to get information. And that's one of the challenges of sharing it with you as it unfolds, is that we're sharing what we know right now today. Tomorrow, we may know more. The next day, we may know more. And next week, we definitely hope to know more. So that as you take this journey with us of knowing information as soon as we know it, it requires all of us to kind of maybe just breathe, not go into a panic, and just trust that we'll continue to bring you information as soon as it becomes available. I don't know that we can right now answer that question related to October 15th and whether or not you've had COVID and whether or not you are eligible for vaccination, but it's one of those questions that we will, as Sherry said, save and make sure that we are looking for the answer for. But for right now, I think I just want to have everybody just kind of, breathe a little bit. We're sharing information very early as we're getting it. This just literally rolled out from the city last week. So you're getting it almost hot off the presses if you've been paying attention, which is what everyone has asked for, but it just means that sometimes you get it and we're sharing with you what we know. All right, so just wanted to kind of maybe put that out there to have everybody, breathe a little bit, take a breath and know that this is new information and we'll continue to bring it forward to you as it unfolds.
Great, thank you, Alicia. Here's one. If Philadelphia does go into a lockdown again, what happens to those that work in Philadelphia?
I'm maybe a little more explanation about the question, but if it goes into lockdown, we're obviously going to practice safety, right, and follow the mandates of our government. So if they tell us certain things, we'll follow those requirements. But we would continue to operate as we did before when they were in lockdown. We are going to provide services. We just obviously wouldn't have admin. Presumably, again, I'm making some assumptions, but presumably in any locale like that, your admin offices would not be open, period, right? It wouldn't just be to reduce traffic. It would be only necessitated traffic. We would take all necessary precautions from a PPE standpoint, from a travel standpoint. We might have to, again, reinstitute travel cards or travel forms that say you're an essential employee and you are doing essential services. So those kind of things, you might recall what we did in the past would probably happen again. So if we go into a similar scenario, we would reinstitute some of the same practices that we would have had in the past when we were under lockdown. But every case is different. Let me say that, this lockdown may look different. So I think the key is that we're flexible. We're looking at what's going on. We're listening to the folks that are making those regulations, and we're at the utmost taking our best precaution and the safety for our people.
And I also want to add, all of the programs should have 3 months supply of PPE. If that's not the case, please get in touch with Sheena and let her know, because we don't know what's going to happen, but one of the things we all agreed to is to have 3 months worth of PPE.
So I agree with Sandy 100%. And the only thing I would add is that Sheena's supply is our emergency supply. So if you have a need in the next couple of days, reach out to Sheena. If you think you're going to dip below the 3 month mark in 2 weeks, go head out to Walmart and start buying some more stuff, please, so that we can keep our emergency stash.
All right, thank you, everyone. Another question. I would like to know, what if you're negative and you have to work with a positive? How are you quarantined by leaving and coming back in and out of the site?
There are protocols in place for working with a COVID positive client. I assume that's what they mean by you're negative and they're positive. I'm just making an assumption here, and I hope that's correct. If not, please clarify your question. You can consult the COVID-19 site where our protocols reside. If you have a specific question, you can send it to safety@rhd.org. The protocols indicate that you wear your mask, your gloves, everything to protect yourself, and proceed to take care of the COVID client and dispose of the items used in a safe manner, which is also described in that document. And then if you have any questions, please reach out to your site supervisor or program manager, or again, safety@rhd.org. Thank you.
So I am not seeing any other questions, but if I have missed one, please someone pick it up for me and let me know. And then let me also check back in with Sarah.
Yeah, I have a few. I did get one, and I'm going to make an assumption that we probably won't be able to answer it right this second, but I do want to put it out there so that we can just know. Someone asked if we will be requiring people who have already been vaccinated to get booster shots. So I don't know if anybody just wants to comment on
Sarah, can you read that again?
that. Yep. So they're asking if folks who are already vaccinated, staff who are already vaccinated, will they be required to get booster shots?
So right
If or
now,
when they become available.
Yep, our definition of fully vaccinated right now does not include the booster vaccine. As that definition changes with the CDC and the other entities that we are following for protocols, we will shift our definition. But the definition right now of fully vaccinated is 1 dose of the Janssen vaccine or the 2-dose series of either Moderna or Pfizer.
Thanks, Emily. I have a couple of more questions. I'm just going to go forward. So are there any programs within RHD doing regular testing of all staff on site, regardless of vaccination status?
What was the last part, Sarah?
Regardless of vaccination status. I'm sorry, are you having trouble hearing me?
No, I can hear you. I just missed that last part.
Sure.
I don't believe so, but someone else could jump in. I don't think regardless of vaccination status, but someone else could jump in.
Yeah, I'm not aware of any off the top of my head. We have had some states that required mandatory testing, but that is contingent upon not getting the vaccine. So unless, and I would defer if Bernie or Sandy, if you have comments. I don't believe Linda's on this call, but I'm not aware of any off the top of my head that would require that outside of a vaccine.
No, Brandon, I'm not either. You know, the Delaware mandate that I spoke of earlier is vaccine or testing. I can't recall anything that's doing both. Sandy, did we miss any?
No, neither is Philly at this point.
I actually just got a quick private chat. There was a question in the chat about what percentage of staff are vaccinated. Is there anyone who can speak to that?
So we don't have, right now, we don't have an accurate number to be able to say, because remember, we weren't tracking. So that's something that I'm sure in the next days, weeks, we'll be able to give more information about how we'll be collecting information about vaccination status to be able to provide that information. So I will say there are, some funders who are, or cities or, municipalities who are asking for that information. So we're using information that we previously had to be able to answer those questions, but we can't give you an updated percentage right now.
Thanks, Sheena. Okay. Are we still required to be taking temperatures every time a new staff person comes into the site?
I can actually take that one. We did remove the temperature taking from the RHD protocol, so that is something that we're no longer requiring.
Thanks, Brian. Okay, I think I have one more, unless more come in while I'm talking. Is there any guidance regarding masking indoors at a minimal distance? All the information we've been told has been to mask indoors at our sites at all times, but I see a few people on the COVID call from Central that aren't masking, which implies some minimum distance.
The guidance is to mask when you are in common areas, I think most people in the call here, if I could speak for myself, I'm sitting at my desk in a corner and I am more than 6 feet away from anybody who's in this area. And there are only 3 other people in this area here that's over a couple hundred square feet. So hope that answers your question.
Thanks, June.
So Sarah, we just got one here in the chat, so I'll give you a chance to look and I'll take this one. Is the temperature checks removed for individuals as well? So I don't know if that means our clients when they say individuals.
Yeah, I can jump this. So that was for everybody. So we removed that in general, the temperature taking from the protocols.
Thank you.
I actually just got another question. Is RHD going to be changing the office requirements for those who used to be fully at home and are returning to office spaces? So are we going to be looking at changing any of those office requirements anytime soon, as more people seem to be going back to common office spaces?
I'm not too sure which requirements you are referring to. We require that masks are worn in common locations in any office, that social distancing is practice, that hand washing is practice, and all the other protocols that we have been referring to for the last year and a half. Certain offices are working with essential staff, and you would need to check with your supervisor on what is required to, and I think Stephanie spoke about this earlier, what's required to keep your department going at this time. The opening committee reviews the opening requirements for different programs and comments on the particular protocols required at that time. Things may change, so please check in as the numbers go up. We have to be more restrictive with the protocols.
We have another question. If this is redundant, I apologize because I didn't hear the last question and answer because I was trying to look through the questions. So with the rising numbers, are we waiting to hit a threshold before we reinstate the temp taking protocols?
We will be following the CDC guidance. The guidance has not required us to use temperature taking at this time. That may change, as I just mentioned. As cases continue to rise, the CDC does change their guidance. We don't make up the guidance ourselves. We follow that guidance from other trusted professionals, the virologists, etc., at the CDC and the OSHA regulations for the workplace.
Great, thank you, June. Sarah.
Okay, I think, yep, I am all out of questions on my end.
So I believe that I've gotten the ones from the chat. If I missed one, again, we'll be capturing the chat. We know that you're looking for answers that we don't have at the moment. So this is one where we will probably take the chat and put the questions into different buckets and organize it. Just want to reiterate, we'll be talking about this tomorrow at the COVID committee meeting. And I'm going to turn it back to you, Marco, for some closing remarks.
Thanks, Sherry, and thanks, Sherry, Sarah, for your great navigating of the Q&A and getting to and surfacing all the questions that are being asked, even those that we know right now we don't have an answer to. So I appreciate everyone's continued patience in our response to the pandemic and our response to not only the Philadelphia mandate, but the other mandates that we are working with. but also, again, as I mentioned, what we believe our response as an organization that is grounded in our values needs to be as well. So as we have more information, we will definitely be sharing it with the community, with the larger community. I think the number one takeaway, if you are working in Philadelphia today and you're not vaccinated, to really reach out to folks within the RHD community, outside the community, to really continue to get any information that you need, to get any questions that you have answered, for you to fully understand the vaccine and the different vaccines that are available. That would be the main takeaway I would ask anyone who's currently working in Philadelphia that is unvaccinated. I want to thank everyone for their time and attention today, and their answering of the questions that were posed as well. I do want to leave us with a thought and carry over a thought that we shared at our COVID committee 2 weeks ago, and that was the pay it forward concept. No doubt we started this call with the challenges and the hurricane and the work that we'll have in front of us and our team down there in recovering from the hurricane. We go into every COVID call and every meeting that we are in together with the weight of the world on many of our shoulders, all that is happening, not as it relates to COVID, but also what's happening across seas in Afghanistan, and just what's happening within our own country, whether that is driven by Mother Nature, or as Byron S. and I were talking this morning, by human nature. I think it's important that we support each other in the environment that we're working in, and those small acts of kindness go a long way. Sometimes it's a simple smile, and sometimes it can be something else. What I would ask the larger community to take advantage of is something that will be ending tomorrow, and that is the opportunity for every staff person at RHD to receive a free t-shirt. And again, a free t-shirt might not be what folks want. There probably is more, but like I said, it's an opportunity without a little effort to pay it forward. So you might have seen the emails from Sarah going through your email box. Many of our staff have not seen that email from Sarah. Sarah's going to put the website out in the chat. I would encourage everyone on this call to pass that website forward. Don't be afraid that it references a survey. The survey is simply your name and address and what size shirt you want to wear. So I would encourage folks to pay it forward by passing that email forward, or start your next meeting with staff with that email, to really allow particularly our frontline staff who don't have an opportunity to read the emails that typically come through, to benefit from that opportunity. Of course, there's also a party referenced for Halloween, and the t-shirt wearing for that party. Let's not lose sight of that. I think it's October 29th, Sarah, if I recall. So pay it forward, look for the email from Sarah, look for the website or the survey link in the chat, and pass it on to your coworkers so everybody has an opportunity to benefit from this freebie. With that, I'll say thank you to all again for joining us today, and support each other, be kind to each other, and see you all in 2 weeks. Have a good day.